Organizations that relied on USAID funding were left with major questions after the agency was shut down. How would they support high-risk groups? And would the lack of funding lead to more HIV and tuberculosis infections?
Thanks to support from the Pulitzer Center, our Larry Miller traveled to Gaborone, Botswana, to examine how the Stepping Stones International is supporting high-risk groups without USAID support. It is the final installment in his series, Aid Interrupted.
At about 6 o'clock this morning, I hopped on a flight from Johannesburg, South Africa to make my way to the capital city in Botswana. After about a 30-minute drive, I arrived at Stepping Stones International. This is an NGO here in Botswana that works with young boys, young girls, teaching them life skills, providing training, and really a safe space to ensure that they are productive, that they are healthy, and also helping them work through traumatic situations.
So here is our counseling rooms.
Beauty Magosha is the program director.
We use a holistic program where we engage the young people themselves, the children and youth, their families and the communities that we work with, ensuring that we empower them with life skills, with psychosocial support, and support them with their education.
The campus of Stepping Stones International was buzzing during our visit. Students huddled in groups, others helping with food delivery on campus, and staff preparing meals. It was alive.
So they come with a lot of traumatic challenges that impede them to be empowered and to grow. So with the provision of the first interest in our program in psychosocial support so that we can engage. And we find that most of our children have suicidal ideations, have have a lot of anger, are dealing with grief that have never been addressed before. So they find themselves not knowing exactly what to do.
For years, Stepping Stones International has helped vulnerable children, young women, and young men with personal enrichment, HIV testing, prevention services, and trauma support. Then, 2 years into a $7 million USAID-backed contract, that funding was cut off without notice. Secretary of State Marco Rubio posting on X in March of 2025 that 83% of USAID contracts were canceled because they spent tens of billions of dollars in ways that did not serve and in some cases even harmed the core national interests of the United States. Stepping Stones was implementing PEPFAR, the president's emergency plan for AIDS relief, which launched under President George W. Bush.
We were implementing PEPFAR USAID project in 8 sites in the district where we were providing orphan and OVC program for the orphan and vulnerable children. We implementing DREAMS program for the adolescent and young women. We were also doing community HIV testing and support for people living with HIV and also providing preventive HIV preventive services to the people that are HIV negative.
To lose that money, that's a huge blow.
It is. It is a huge blow to the beneficiaries because also we didn't have time to prepare our beneficiaries of our exist. So we just left them like that.
The World Health Organization lists Botswana as a high-burden country for its prevalence of HIV. 15.7% of adults here are HIV positive, but considerable progress has been made, decreasing the mother-to-child HIV transmission to about 1% and surpassing key United Nations HIV benchmarks for testing, treatment, and viral suppression in 2022. The fear now is that without funds, progress could be reversed. Kennedy Mumpele is the executive director for the Center for Youth Hope, which cares for young people living with HIV and AIDS.
We just need to see how we can do this because, it's difficult to gain these strides like Botswana did. It will be very painful if we slide back.
Botswana has signed a new 3-year health agreement with the U.S. State Department worth nearly $500 million. The U.S. will contribute $106 million. Botswana will put up the rest. The State Department says that the goal is to sustain progress beyond Botswana's HIV targets. But the agreement does not replace all the USAID money groups like Stepping Stones lost when their contracts were canceled in early 2025.
Kind of an amazing story.
Dr. Jennifer Cates is Senior Vice President and Director of the Global and Public Policy Program at KFF.
The U.S. has been quite generous giving funding to countries. What's being asked of countries? And should there be some kind of co-investment requirement, which frankly is done by many other global health institutions. What's happened over time is what started as an emergency program in 2003 and was meant to stave off a major crisis on the continent of Africa, became part of like the way many countries were responding to their healthcare system. And at some point, and maybe in the last 5 years or longer, there have been increasing discussions about what's the end game here? How long will the U.S. be doing this? And I think good questions. Should the U.S. do this in perpetuity?
Newly released State Department data shows what experts say are some warning signs since the USAID funding cancellations, with noted declines in global HIV testing, diagnosis, and prevention services.
If I had to hypothesize, it's hard to see how everything that happened last year and these ongoing changes are not going to negatively impact HIV outcomes. Will it be a catastrophe? I'm not going to say that. There were some predictions that it would be, but it's hard to see how it won't have a negative impact.
A spokesperson for the State Department told us that there are no plans to sunset PEPFAR, and they remain committed to responsible stewardship of the program. But in this new reality, many NGOs are left to figure out how to fill the gaps and avoid the dangers that may lie ahead without support from USAID.
I will not throw away the great work that was done in the past. I think even for us as an organization, the good systems, the quality implementation most of that support, we got it from USAID to be where we are.
Larry Miller, WUSA 9.
Larry did extensive reporting in South Africa, and you can see all of it streaming right here on WUSA 9. All 3 parts, including new interviews and extended conversations with experts on the future of global health. And you can watch that starting this weekend, again, right here on the WUSA 9 streaming app.